Okay, I'll make a start now. So welcome everybody to the Introduction to Domestic Abuse and Sexual Violence webinar. I'm Hayley Coates and I'm the Network and Innovation Manager for IRISi. It's really great that we've got a real mix of people attending today and that real mix of dental professionals present. For some of you, you've said that you've never had any form of domestic abuse training, or if you have, it wasn't dental specific. So today, I hope you go away with a greater understanding of the important role that you can play as dental professionals to support your patients who are experiencing domestic abuse and sexual violence. So I started working with dentists and dental teams back in 2016, and many people said when I delivered training that any training that they had previously was either generic or if it was aimed at primary healthcare, it usually had that focus for GPs on how they can identify and respond to their patients within general practice. So it's good to see that we've got some of you today that have said that you've been to training that has been tailored for that dental team. Oh, okay, sorry, let me just turn that up a minute. Can you hear me now? We'll just pop in the chat if you can hear me okay. You can hear? Yeah. Perfect, thank you. The majority it seems like you can hear. Maybe turn it up on your side. And I'll just keep making sure that the microphone is. I have got it up to 100, so yeah, perfect. Perfect, thank you. Just before we begin on the session, I would like to do some thanks, Christabel. I'm just going to go through some housekeeping. So it is going to be a 45-minute session. As you can see, cameras and audio are automatically turned off, so you won't be seen or heard. But there is a chat box, which obviously many of you have just been using. And I do have Christabel, who's our admin support, who will be kind of adding information as and when and answering any queries as we go. There is a question and answer box as well. So if you do have any questions relating directly to the presentation, I'll try to respond in real time, and I'll try to leave some space at the end for those that I haven't gotten around to. What I will also do is I will share any question answers on a document and send that out after the webinar if I've not been able to respond to all of them. The webinar is being recorded and I will share this afterwards. And I'll also send up a follow-up email with the presentation, links to resources, and research that I've discussed and anything that's left over. Just finally, before we move into the session, we know that domestic abuse and sexual violence impact widely, whether that's you personally or colleagues or friends. I won't be going into huge detail today, but I just want to say, just please look after yourself as we work through this. And if you are impacted, Christabel's going to share a link with all some useful numbers nationally, and I will be sharing them at the end of the session too. Thanks, Christabel. So the aim of today's session is to introduce domestic abuse and sexual violence and to explore the critical role of the whole dental team. Today, I'll be providing a brief overview of the extent and impact of domestic abuse and sexual violence across the UK, and you'll go away from this session recognising domestic abuse and sexual violence as health issues and understand the critical role you as dental professionals can play. I will also highlight some of the physical and behavioural indicators that you can look out for when your patient attends their appointment. And lastly, we'll provide information about how we at IRISi can help you and your practice in the future, whether that's through future learning opportunities to increase your confidence and understanding of domestic abuse and sexual violence, or any consultancy support to make sure that that whole dental team is equipped and domestic abuse and sexual violence aware. Domestic abuse and sexual violence is such a complex and emotive subject, and we really can't cover a lot in this 45-minute session that will equip you with all the necessary skills, that confidence to respond to disclosures. But we are providing further training opportunities at a later date. And I'll cover some of the topics that we're going to be covering today in a lot more detail, as well as some vital information that we won't be covering in this session, such as understanding why someone may stay in that relationship, how to ask and respond to patients experiencing of domestic abuse and sexual violence, and what you need to do next to ensure your patients are safeguarded and supported appropriately. So today is a really good starting point, and hopefully by the end of the session, you'll want to learn more about how you can support your patients and build your confidence and understanding on this very harrowing subject. So many of you said in your registration form that you aren't familiar with IRISi and don't know who we are. So I'm just going to spend the next 2 slides just giving you a little bit of a brief overview of who we are and what we do. So we are a social enterprise dedicated to improving the healthcare's response to gender-based violence, and we're the only national-based organisation that solely works across and within healthcare to improve the responses specifically to domestic abuse and sexual violence. We bridge the gap between healthcare professionals and specialist support services. Oops, it's a slide, sorry. Is it back again? I think it is. Sorry about that, everyone. So we bridge the gap between healthcare professionals and special support services for victim survivors of domestic abuse and sexual violence. So IRISi launched as an organisation in 2017, but has been working and running programmes in healthcare since 2011. We have 2 interventions that are currently commissioned across the UK, and our flagship intervention is the IRIS programme, which improves general practice response to domestic abuse. Our second is the Advise programme, and this works within sexual health clinics. We also provide advice and consultancy in the field of gender-based violence and health, while scaling our evidence-based commissional programmes across the country. We also work with academic colleagues to develop new innovations in evidence-based solutions, providing expertise within health and domestic abuse. We also work alongside colleagues to champion the work on a national policy level. Our ambition is to develop a suite of interventions of training to support clinicians to recognise and respond to the needs of patients affected by domestic abuse and sexual violence, and that's across a range of healthcare settings. We want to make sure that healthcare professionals are supported to confidently and safely address domestic abuse and sexual violence, but also have that understanding of the impact this has on victim survivors, their health, both physically and mentally, and to recognise that this often is a direct result of the abuse that they've been subjected to. So I've just briefly mentioned our 2 interventions. So we've got the Advise programme and the IRIS programme, and both these programmes offer a comprehensive specialist training and consultancy to all practice and clinic teams. They provide a simple and direct referral pathway into specialist support workers, who also provide an ongoing support to the practice and clinical teams. Each site has a clinical lead who work within healthcare, and they work very closely with the specialist support worker and practices or clinics that have signed up to be part of the programme. This training is ongoing, so it's not one-off, and it provides refreshers and mop-ups for new staff. We know this has the highest impact in terms of change in practice and then recognition and then referral rates. We currently work with specialist services to implement there's 57 of these programmes across the country. That's across England, Northern Ireland, Jersey and Wales. As of March 2024, the IRIS programme has received 43,535 referrals for patients who've experienced domestic abuse, while Advise has received 1,051 referrals, and the Advise programme is a relatively new programme that we've had over the past year or couple of years. We also provide expert advice and consultancy to healthcare settings such as specialist training sessions, support for HR teams and the development of policies and procedures. And we also work in collaboration with healthcare to pilot new interventions, and we're currently exploring health visiting and school nursing model. One of the things that we're also really passionate about is working in collaboration with researchers to explore other evidence-based interventions within the healthcare settings. So we're currently working on a model called the IRIS Plus, which is a randomised controlled trial, and this is an expansion of IRIS, so it works with male victims, children and young people, and perpetrators of domestic abuse, and this is taking place in 3 IRIS areas across the country. We're also involved in the PREDA study, which focuses on the experience of healthcare professionals affected by domestic abuse. And we're working with researchers and practitioner health. And you're probably already aware of practitioner health, as it's a free and confidential service for NHS primary care practitioners, focusing on mental health and addiction, who support primary care professionals like yourselves across the UK. And then we're also involved in a project called Named, which is looking at nurses and maternity staff experiencing of domestic abuse. So now we're going to move into the main content of the webinar today, and we're going to start off by looking at what domestic abuse is. So the Domestic Abuse Act 2021 describes domestic abuse as an incident or a pattern of conduct where someone's behaviour towards another is abusive and that they are personally connected to one another. So that could be a partner, an ex-partner, a family member or carer. Domestic abuse isn't always direct or obvious, but it can be subtle and an insidious manipulation. It can encompass a range of different forms of abuse, some of which you can see on the slide. These types of abuse often intersect and overlap, and specific tactics of abusers can fall into multiple categories. So you can see that coercive control is in the middle, and it's important to highlight as coercive control underpins all domestic abuse, and for many survivors it's really hard to define and recognise, but it leaves long-lasting impact and trauma. Coercive control is an act or a pattern of acts of assault, threat, humiliation, intimidation, or other abuse that is used by a perpetrator to harm, punish, or frighten their victim. This controlling behaviour is designed to make a person dependent by isolating them from support, exploiting them, depriving them of independence, and regulating their everyday behaviour. Coercive control is now a criminal offence, and this has been the case since 2015. Harmful practices, so-called honour-based abuse, forced marriage, female genital mutilation or cutting, sit outside this definition. However, domestic abuse sector still views them as sitting within this definition of domestic abuse, as perpetrators and victims are almost always personally connected, and the abusive tactics used are very much the same as what you can see on the slide. Domestic abuse doesn't discriminate, and anyone can be a victim or survivor, and anyone can use abusive behaviour within their relationship. Domestic abuse affects people from all backgrounds, ethnicities, age groups, abilities, and social classes, although some of those affected may face different barriers. During my next awareness session that I'll be delivering in April, I'll delve deeper into the different types of abuse perpetrators will use to gain power and control, including forced marriage and so-called honour-based abuse. And these harmful practices can also be perpetrated by family members too. I will also highlight how these types of abuse can be observed and identified in a dental context. For example, victims of so-called honour-based abuse may have family members attending the appointments with them. They may talk over the patient that you're seeing, may talk for them, or may use the guise that your patient speaks little to no English, so is there as an interpreter. However, it's really, really important in these situations that you use an independent interpreter and never use family members. I'd just like to pause and just remind you all of self-care. I am going to be talking in more detail around the prevalence of domestic abuse. I will be sharing some statistics around children and young people. So I just want to kind of remind you to kind of look after yourself and take that time as we work through the next couple of slides. So domestic abuse is a national crisis that affects 1 in 4 women and 1 to 6, 7 men in England and Wales. In the year ending March 2024, an estimated 1.6 million women and 712,000 men aged 16 years and over had experienced domestic abuse. And the year ending March 2020, there were 798,000 women and 275,000 men who were victims of sexual assault. As you can see, this is a very high prevalence of people who are affected by domestic abuse or sexual violence across the UK. And I just wanted to share a story of when I was delivering a training session a few years ago to a dental team. And one practice in particular that was in a semi-rural area said they didn't want the training. The practice manager shared that they didn't need it, it doesn't happen in their area, and it doesn't affect their patients. I was working with a colleague at the time that was previously co-located in a police station within that area, supporting cases that came in to the police station around domestic abuse. And I was able to provide some of that local data and that high prevalence that actually that dental practice was in, there was a lot of there was a lot of people in that area, therefore a lot of patients that they were seeing that were affected by domestic abuse. And we were able to kind of encourage them to sign up to see, their role and how they can identify and respond to patients' experiences. So if you are sitting here today and have some of these same thoughts, just think about the statistics that we're sharing. It will be happening in your area. Your patients and your colleagues will be affected by domestic abuse and sexual violence. And those that work in this field know that it's just the tip of the iceberg. Recorded data will never completely capture the extent of domestic abuse or sexual violence, which we know remains highly unreported. So the Domestic Abuse Act, which we covered in the previous slide, now recognises children as victims of domestic abuse in their own right. So previously, it was often seen as victims and their children, whereas now children are seen as victims themselves. So you can see that 1 in 5 children are affected by domestic abuse. And children who witness domestic abuse are at risk of both short and long-term physical and mental health problems. I've had experience of working and managing services for children and young people affected by domestic abuse, and I've seen firsthand the impact that it's had on them. Each children and young person will be affected differently to the trauma of domestic abuse. And even if they're not physically harmed, children may experience emotional and psychological damage as the result. So I've worked with children who have tried to intervene and protect the parent who's been physically assaulted by the perpetrator. Often that's their father. And there's also been cases where the mother has been holding the baby when the assault took place. Being exposed to domestic abuse in childhood is child abuse, and children and young people may experience domestic abuse by both directly and indirectly. Um, and we as professionals have that safeguarding duty to protect them. Another shocking statistic, which again is highlighted on the screen, is that 1 in 3 pregnant women experiencing domestic abuse. And pregnancy can be a trigger for domestic abuse, and then any existing abuse may get worse during pregnancy or after giving birth. Abusers will often increase their controlling and emotionally abusive behaviours during this time, and there's also a high risk of physical violence. Abuse during pregnancy can have health and well-being implications for both mother and the unborn child. It always seems sadder when we see the effects that domestic abuse can have on children and young people. And I've seen many cases where both mother and child have had to flee to safe accommodation or being supported in the community. And by having that support, they've they've thrived and become, working through the effects that they've both had around domestic abuse. And that's why sessions like today is really important. And even more in-depth sessions are vital for you to be able to understand them complexities of domestic abuse, who it affects, and have them right tools to support the patients to find that specialist support. Last year, the National Police Chief Council declared VOG, which is violence against women and girls, to be a national emergency, noting that it has reached epidemic levels in England and Wales in terms of its scale, complexity, and the impact on victims. Despite these overwhelming statistics, domestic abuse and sexual violence is still not talked about enough, and around 85% of victims seek help from professionals on average around 5 times in the year before they've received effective help to stop the abuse. I think it's also really important to share that we're not just focusing on patients experiencing domestic abuse and sexual violence. We know healthcare professionals can experience this themselves, and you'll often face your own unique barriers to disclose and seek support. For the many training sessions I've delivered for dental teams and other kind of health training that I've done, around 9 times out of 10, I've had somebody disclose from at least one person, whether that was current or historic abuse themselves or from family members are experiencing it. I've also worked personally with dental professionals who are survivors themselves, and it is something that I'm really passionate about to raise awareness, because it's not just patients that are affected, it's you, it's your colleagues, and it's really important that you also get that support and that equality to provision yourself. There was a recent study on the healthcare professionals as domestic abuse survivors. It's called Workplace Impact and Support Seeking. You might have seen that. I will share this study with you after the session today, but that was published recently following a cross-section survey to understand healthcare professionals' experience of domestic abuse. So among the 192 healthcare professionals who were survivors and that responded, stated that they had different forms of abuse. So it was psychological, sexual, economic, physical, and these were the most common types of abuse that they were experiencing. In the cases, 90% of these abusers were male, either partners or ex-partners. And 85% reported abusers directly interfered with their work, and 92% reported their work and career were affected. And I worked with a dentist who was affected by domestic abuse, and her perpetrator, who was her ex-partner, contacted the dental practice where she was working to kind of find out what time she was working that day, what time she was going to be finishing. And the receptionist unfortunately did share that information, and the perpetrator was waiting for her on the car park. So it's really important that when we are looking at cases around domestic abuse, we are thinking about our colleagues and thinking about sharing sensitive information with, family members, partners, ex-partners, as well. So are domestic abuse and sexual violence health issues? Yeah, they are. Unfortunately, they're not always viewed as a healthcare issue, though, and whilst we understand that healthcare services in the UK can be stretched, often seeing patients with repeat conditions and complex health histories, it's really vital that healthcare professionals understand the impact that domestic abuse and sexual violence can have, which can significantly impact your patient's health. We know that health services are trusted environments, and we'll see people from every background and walk of life who has or is currently experiencing domestic abuse. Evidence tells us that 80% of women experiencing domestic abuse seek help from health services, and these are often their only or first point of contact. Repeated findings from domestic homicide reviews have highlighted that health professionals can often can offer patient survivors a safe place to disclose and seek support at an earlier opportunity. And domestic abuse and sexual violence are global public health issues, and health professionals like yourselves play a vital role in its response. Therefore, it's critical that awareness about domestic abuse and sexual violence is embedded within practice of all health settings. So on the slides, I'm just going to bring up a few examples. It isn't an exhaustive list of the health impacts, and I'll also be covering specific health indicators for dental professionals shortly. I'll just bring them up on the screen. So we also know that the complexities of domestic abuse and sexual violence, and therefore patients who experience any of these forms of violence and abuse may present with either one or multiple health impacts. So let's take a little look at the ones that you can see on the screen. And again, I'll be sharing a little bit more on dental specific ones shortly, and I'll be providing in the next training sessions and a lot more detail in these. So we've got the chronic physical conditions, so gastrointestinal disorders, fibromyalgia, chronic pain, chronic tiredness, and almost all of these conditions can be exacerbated by stress, and they are more common in victim survivors. So living with trauma has that profound impact upon victim survivors' physical health. So when we're tired, stressed, overworked, this can take a toll on our physical health. So imagine someone experiencing any number of these forms of abuse we're looking at, constantly walking on eggshells, being anxious, afraid, nervous, being consistently under high stress within the home. No wonder that their health is impacted by it. So emerging evidence suggests that experiencing domestic abuse may also be associated with worsening menopause symptoms, and that menopause can lead to changes or escalation in domestic abuse. Domestic abuse and sexual violence can have a devastating and long-lasting impact on the mental health of victim survivors, and both research and data from specialist services have shown this over the decades. So women who've experienced domestic abuse are 6.5 times more likely to attempt suicide. It's lifetime experience of any type of domestic abuse associated with suicidal ideation, psychological distress, and depression, and both for men and women experiencing physical domestic abuse face an increased risk of depressive symptoms, substance misuse, and the development of chronic mental illness. It's also important to consider how intersection identities can be an increased risk of poor mental health in association with domestic abuse. So, for example, the LGBTQ plus community and victim survivors are almost twice as likely to attempt suicide and more than twice as likely to self-harm. Disproportionately high levels of Black and minoritized women have self-harmed, contemplated suicide, and attempted or died by suicide, with domestic abuse found to be the causal or contributory factor rather than any pre-existing or diagnosed illness. There's a higher incidence of self-harm and suicide amongst young Asian women experiencing domestic abuse. And also, patients who may have experienced trauma may struggle to engage with or trust healthcare professionals, and perhaps could appear angry or uncooperative. And disabled women are twice as likely to experience domestic abuse. Again, it's important to consider drug and alcohol use. So drug and alcohol can often be used as a coping mechanism for those experiencing trauma as a result of the abuse. And victims of abuse have a higher rate of drug and alcohol use that have started before or after domestic abuse. And at least 20% of high risk victims of abuse report using drugs and alcohol. And lastly, perpetrators may exploit victims' existing drug and alcohol use or coerce them into starting or increasing the use. So let's move on now to the role of the dental team and the role that you dental professionals can play. You do have a critical role with identifying and responding to patients experiencing domestic abuse and sexual violence. And you as dental professionals can have an enormous impact in helping your patients to access appropriate safety advice and support from specialist services. We've just seen how prevalent domestic abuse and sexual violence is in society, and this means that many of your patients that attend practice for an appointment may be experiencing current or historical forms of abuse or violence. So as dental professionals, you provide a regular and consistent healthcare environment where patients are seen in person and where you often form them long-lasting relationships. So many of your patients attend the same practice for several years, and many of your patients may be, you may be seeing them every 6 months for their routine checkup. I was working with a client a few years ago who after already receiving specialist support from the domestic abuse service, had left her partner, said she disclosed to her dentist during a routine appointment, and her dentist responded and said that when she'd come in for an appointment previously, she thought that something, and the words that she used was a bit of a miss, but she didn't know how to ask or probe further. So she knew her patient, she knew how her patient behaved and was seen in the practice. Something didn't seem quite right, but she just didn't have them skills, didn't have the confidence, didn't know really how to ask and delve a little bit further. And this just shows that even if there's no physical, indicators of abuse, you can still observe them behavioural presentations of your patients and just use your gut or professional curiosity to probe a little bit further. Maybe if that dentist, had more awareness and was able to respond or ask a probe further, the patient might have got support at a much earlier stage, or that dentist might have got a disclosure at a much earlier stage. So although the consultation room where the patient is usually seen would be an ideal place to identify the signs of domestic abuse and sexual violence, it's really important that the whole team knows their responsibility to support patients experiencing domestic abuse, because the reception team play a huge role in observing behaviours of patients in the waiting room, can pick up on a range of indicators of physical, financial and psychological abuse. And then these concerns then can be shared with the dentist or the dental professional that the patient will be seeing for them to observe and potentially inquire about them concerns. Those who are pregnant, you might see more in the dental practice, as they'll be entitled to free checkups and treatment during their pregnancy and 12 months after giving birth. And I've just shared in the slide before around the risk of domestic abuse for pregnant women and how that can escalate or start. And it means as you as professionals, have a unique opportunity to see patients who are pregnant and begin to identify if that patient is experiencing domestic abuse. Oral and maxillofacial surgeons will often see patients referred from the dental practice, but we'll also see patients attending accident and emergency departments too, and presenting with dental and more severe injuries. And therefore, you are in a key position to identify domestic abuse as well. Just like to kind of add, please don't assume that just because you might not be the first healthcare professional to see the patient, that you might not need to ask about domestic abuse. Some dentists and other healthcare professionals might not have considered that the identification of domestic abuse when their patient presented, or might not have seen that, their responsibility to ask, either through lack of training or just the uncertainty of what to do, opening that Pandora's box. How do we respond? What do we do next? How do we, help patients to get the appropriate support that they need? Or they themselves might have assumed that somebody else might have, spoke to that patient, maybe social services or police or somebody else that might be working or supporting that patient. Um, so it's really important that, as maxillofacial surgeons, that you kind of probe further, ask how the patient have got the injuries, especially if the descriptions don't match the injury. It is better for somebody to be asked numerous times on numerous occasions than not to be asked at all. What's the worst that can happen? They could be offended at being asked, but more importantly, if you do ask, you might just have saved their life. As I said before, it can take victims multiple times to seek support, and they may have declined in the past or said that they weren't affected as they may not be ready for support. And I believe with the right training, information and tools, the whole dental team, who are trusted professionals, can provide that unique lifeline for patients experiencing domestic abuse. Don't underestimate the power of posts and leaflets as well. I had a patient who said that, she was in the waiting room. She was with her partner. She saw the poster on the wall. When he went in for his appointment, she took a note of the number and she contacted the specialist service for support. And she did say that day in that dental practice, that waiting room changed her life in more ways than one. So the impact of domestic abuse and sexual violence on oral health is extensive. So it's ranging from direct physical trauma that causes dental fractures to the subtle impacts of illnesses associated with stress, such as bruxism and temporal mandibular joint disorders. On average, 75% of domestic abuse related injuries present in the head or neck region, and as dental professionals, you routinely assess these areas, which puts you in a critical position to identify injuries caused by domestic abuse or sexual violence. So some of the health indicators you can observe are highlighted on the screen. So we've got the interoral bruising occurs when soft tissue is pressed against the teeth and bones, which could be caused by that repeated hits or slaps to the face. So we've got the fractures or signs of healing fractures to the mandibular, maxilla or nose. And it's really important that when you're looking at x-rays that you're looking for kind of signs of fractures or healing at different stages as well. Soft and hard palate bruising or scratches can indicate forced sexual attacks. And that can be also identified with patients' behaviour in the chair as well. So are they flinching? Are they, when you're coming close to their mouth? Are they, flinching when it's a male, perhaps a male dentist? So it's kind of looking at all them other indicators around that as well. So there's abscessed teeth, traumatic tooth injuries, or torn frenum from physical assaults to the face. You might observe bite marks, hair loss, or burns. There may be facial bone or jaw fractures. Bruxism, so patients may be grinding their teeth as a result of that mental toll that domestic abuse is having on them. You might have pattern bruises to the face and neck area. You could have, you could observe ligature marks or kitty, I can't say the word, sorry, PTKI, which are them small red or purple spots that are formed on the skin due to bleeding. So you might observe them in your patient's mouth or neck, and that could be from an attempted strangulation. It's also really important to consider how these presentations appear on skin types, so on patients with black or brown skin, and I will be sending some guidance around how you can observe that on your patients after the session. Some other indicate of how patients may present in the dental setting, so I won't go through them all in detail, but we know domestic abuse and sexual violence aren't only physical, and we need to recognise physical injuries like unusual bleeding, cuts, burns, bruises, repeat broken bones. What are the explanations for these injuries? Do they make sense? And does the injury align with how the patient said that it happened or became hurt? So just quickly, some of the ones on here. So there may be neglected oral health with signs of emotional stress, so depression, dental anxiety, substance misuse. Your patient might appear socially withdrawn, hesitant, or maybe unusually aggressive, or exhibits sudden behavioural change. I just mentioned before about that patient that was in the dental practice before, so it's noticing them different behavioural changes. Maybe your patient needs to be back home at a certain time. Maybe they're becoming stressed about it. They could be accompanied by a partner or family member, or have signs of an overbearing partner or family member. Maybe not making eye contact, or just have that general unease during consultations. You may observe delays or non-compliance with treatments or advice not followed after that you've given. And also, just lastly, it's really important to link in with child not brought. So really thinking if the child hasn't been brought to the practice, just linking in with that whole family to get a better picture. So as we're coming to the end of the presentation, I just wanted to share, kind of what's next and what, support possibly is out there for you. So if you have found today interesting and you want to know more about what you can do in practice to address and respond to domestic abuse, then you can reach out to discuss how we can support you and your dental teams further. For example, we can provide dedicated training for the whole dental team for that whole practice approach, provide consultancy to support the development of a domestic abuse policy, perhaps support practice managers or HR teams around staff affected by domestic abuse, or more in-depth training for domestic abuse champions and safeguarding leads. We do have 2 further sessions coming up that is specific and tailored for the dental team. So we have one in April and the other in May, and Christabel will share in the chat. So these are more in-depth sessions that will cover as all the objectives that you can see on the screen. So today just was that introduction, and we've barely scratched the surface. So these sessions will delve deeper into domestic abuse and sexual violence, which includes coercive control, non-fatal strangulation, and harmful practices. We'll unpick the myth of why doesn't she just leave or he leave, instead of reframing that to what keeps them there, to start to understand them complexities and barriers faced by victim survivors. We'll reflect on domestic abuse and sexual violence health issues, including how patients may present in a lot more detail so that you can use that clinical inquiry to identify and respond to patients, and then explore risk assessing, safeguarding and documenting concerns. And Christabel will, like I said, will share these, how you can book onto them sessions. You will receive a unique code that you can access these courses. So they are going to be a paid session, and we would usually charge £80. However, for those that are attending today, you will receive an early bird access code, which I will share with you after the session. And these sessions are limited to 30 people per course because we want it to be a little bit more interactive. I want to be able to kind of talk to you, to answer questions in real time, and to give you the confidence and skills to support your patients. Here are the useful numbers again on screen that Christabel will share with you. And again, we'll pop that in the chat box. Please, look after yourself, reach out to services if you need to. And hopefully, I know I'm coming to the end of the session now, I'm running a little bit behind, but hopefully, you have got time before you delve back into work just to kind of pause, to grab a cuppa, to, take some time out just to kind of that self-care after this session. So thank you everybody for attending today. You can see on the screen there is a QR code which will send you to the evaluation form. Like I said, you will get a recording of today's session. I will be sending all the information about what I've been talking about, some of the research, how you can book on the training, and just to add, the training session you will all receive, if you did the 2 hour training session with me next, a CPD verifiable certificate that you can use in practice. Um, but yeah, thank you so much for taking your time out. I really appreciate you joining me today. And if you do have any questions, I know I haven't been able to answer, and if you have put them in the chat box, please put them in now, and I'll get back to you either separately or as a whole, as in a whole group. Thank you.